Hello, all. This is Emily Cody. Today, I am presenting my presentation of DBT from Theory to Transformation, a clinical social work case presentation. This will be a clinical case for my field placement that demonstrates the application of dialectical behavioral therapy, or DBT, within an outpatient mental health setting. Before I begin, I want to note that all client information has been de-identified to protect confidentiality and comply both with HIPAA regulations and the NASW Code of Ethics. The purpose of this presentation is to demonstrate my understanding of DBT, the interventions that were selected, and how these interventions align with professional social work practice and can be seen in a clinical context. Throughout this presentation, I will discuss the client system, presenting concerns, the agency where services were provided, the treatment plan, and DBT interventions that were implemented. I'll also connect this to the Council on Social Work Education competencies and reflect on my own personal growth during the field placement. My goal is to demonstrate how evidence-based practices, strong therapeutic relationships, and core values of social work together to promote meaningful and lasting changes for clients. So a quick presentation overview of the objectives. Today's presentation follows the required format for our field seminar. First, I will introduce the client system and discuss presenting concerns. Next, I'll describe the outpatient mental health agency where I completed my placement and explain my role as a social work intern. From there, I'll review the treatment plan and explain why DBT was selected as primary intervention. I will then discuss specific DBT skills that were taught, review client progress, connect the work to CSWE competencies, and conclude with my own conclusion and what I've learned throughout this experience. Okay, so before we start anything and discussing the case itself, I think it's important to provide a brief overview of DBT. I honestly did not know much or anything about DBT before starting this field placement back in January. I have learned so much since. DBT was originally developed by psychologist Marshall Linhan during the late 1980s to treat individuals diagnosed with borderline personality disorder, those who experience chronic emotional dysregulation and even suicidal behaviors. But since that time, extensive research has demonstrated that DBT is effective for many other mental health concerns, including anxiety disorder, depression, trauma, eating disorders, substance use disorders, and any difficulties with emotional regulation. One of the unique aspects of DBT that I found is that emphasizes on balancing two ideas that appear opposite but are actually very complementary. The first is acceptance. As clinicians, we accept clients exactly where they are without judgment. The second is change, where we accept clients as they are, and we also help them develop healthier behaviors, coping strategies that improve the quality of life. This concept of balancing acceptance and change aligns closely with the values of the social work profession. We strive to honor each client's dignity and lived experiences while also empowering them to make positive changes. DBT is therefore much more than a collection of coping skills. It provides a structured framework for helping the clients understand their emotions, improving their relationships, tolerating distress, and build lives that are meaningful for them. One of the key concepts that I learned through DBT is the biosocial theory, which we've also learned in a lot of our classes here at King. The theoretical foundation of DBT is known as the biosocial theory. This theory proposes that emotional dysregulation happens through the interaction of two primary factors. The first factor is biological vulnerability. Some individuals are naturally more emotionally sensitive than others. They may experience emotions more intensely, react more quickly to emotional events, or require more time to return to their baseline or their normal emotional feeling. Um, the second factor is an invalidating environment. This refers to like the environments in which an individual's emotional experience are dismissed, minimized, criticized, or misunderstood. Even with trauma, um, can also be an invalidating environment. When these two factors interact repeatedly over time, individuals often fail to develop effective and emotional regulation skills. um, Rather than viewing the clients as difficult or like non-compliant or unable to help. DBT encourages um, clinicians and therapists to understand behaviors within the context of each person's experience and just look a little deeper. I have learned a lot through my supervisor, Alex, and also with my research of learning about DBT. And I appreciate that this framework because it does align with the person and environment perspective that guides social work practices. Instead of asking, like, what's wrong with this client, we ask, like, what experiences have contributed to these behaviors. The shift in perspective promotes empathy, collaboration, and a lot of strength-based interventions. DBT skill modules. DBT is organized into 4 major skill modules, each addressing a different area of functioning. The first one that you all are probably pretty familiar with is mindfulness. Mindfulness teaches clients how to remain fully present in the current moment without judging their thoughts or emotions. Many clients spend significant time worrying about the future or replaying past events. Mindfulness helps them slow down and become more intentional in their responses. The next one is the second module is emotional regulation. This helps clients identify emotions, understand the function of emotions, recognize triggers, and develop healthier responses instead of reacting impulsively. The third module of DBT is distress tolerance. These skills are especially useful during crisis. Instead of making situations worse through avoidance or impulsive behavior, clients learn practical strategies to tolerate distress until emotions decrease naturally. And the final module is interpersonal effectiveness. These skills teach clients how to communicate assertively, establish healthy boundaries, advocate for themselves, and maintain positive relationships while preserving self-respect. Throughout treatment, these 4 modules work together. Rather than teaching isolated coping skills, DBT helps clients develop an entire toolkit that they can use across many different situations and relationships. All right, so now that I've provided an overview of DBT, I'd like to introduce the client system and her presenting concerns. This is a client from my current field placement, and as mentioned earlier, all identifying information has been changed to protect confidentiality. The client is an adult female in her 30s who sought outpatient therapy due to ongoing anxiety, emotional dysregulation, and difficulties within her relationships. She described feeling overwhelmed by conflict. She often found herself reacting emotionally before she had time to think through the situation, or not be so reactive. During the initial assessment, the client explained that even relatively small disagreements could quickly escalate emotionally. She described becoming flooded with anxiety, frustration, self doubt, which frequently resulted in her withdrawing from others, responding impulsively, or just negative effects on her relationships. After these interactions, she often experienced guilt, negative self talk, and this reinforcing a cycle that affected both her emotional well being and her relationships. One of the most important aspects that I have learned through my placement in learning about DBT is looking beyond the presenting symptoms. Rather than simply identifying anxiety or emotional dysregulation, we explored the client's broader life context. This included family relationships, social supports, occupational stresses, coping strategies that she's used previously, therapy experiences that she's had previously, and then her own strengths and goals. Um, this strongly reflects the person in environment perspective, which reminds us that individuals cannot be understood apart from the system in which they live in. Rather than asking like what symptoms does the client have, we ask what experiences and environmental factors are contributing to the client's current situation. While the client experienced significant emotional distress, she also possessed many strengths, and she demonstrated insight into her behaviors, consistently attending therapy sessions, completing homework assignments, and expressed genuine motivation to improve her relationships and overall quality of life. These strengths were important foundations to build on and to circle back to throughout treatment. So piggybacking off of her strengths on the last slide, being able to understand her strengths and complete the assessment. As you all know, assessment is one of the most important responsibilities of a clinical social worker. It really guides the intervention that follows and the therapy that is going to be happening with the client. During the assessment process, I specifically learned that this client's emotional reactions were not isolated incidents. Instead, they represented like long-standing patterns that had developed over time. Although this client was very aware and she understood that her reactions were often inconsistent to the situations, she described feeling unable to slow herself down once the emotions became so intense or the situation became too so hot and intense for her. Rather than focusing solely on diagnosis, we completed a comprehensive biopsychosocial assessment. We explored biological factors, including stress responses and emotional sensitivity. We discussed physiological factors such as anxiety, thought patterns, and coping strategies. We also examined social influences, including family relationships, communication patterns, support systems, and current environmental stressors. Throughout the assessment process, I also maintained a strength-based perspective while identifying areas for growth. It was important that we recognize her resilience and she demonstrated intelligence, insight, perseverance, and willingness to learn new coping strategies on top of the strategies that she already knew. These qualities became protective factors that supported positive treatment outcome with her. Assessment was not something completely done in just one session and then kind of forgotten about. Instead, it's really ongoing throughout the treatment. I checked in with her on how she was doing weekly. We kind of reassessed progress, modified interventions based on her needs, or if she encountered any new challenges. A little bit about my field placement. So my field placement took place at Kinder Therapy, a private outpatient behavioral health practice that serves adults, couples, and families. The agency emphasizes evidence-based treatment approaches. My supervisor, Alex Thompson, who owns the agency, is very passionate for DBT. She also used CBT, motivational interviewing, trauma-informed care. She is shame-based, certified, and a lot of strength-based interventions. One aspect I appreciate about this placement was the emphasis on collaboration. We would see patients together and then discuss um, the cases and brainstorm about ways of moving forward with clients. And then she also looped me in on past clients that she's been seeing for years and kind of helped me learn more about longevity of helping clients. My responsibilities gradually increased as my confidence and competence developed. Initially, I primarily observed sessions, discussed clinical reasoning with her. As I progressed and the placement progressed, I became more involved, conducting assessments, participating in treatment planning, and then leading my own therapy sessions. One of the greatest lessons I learned during the placement was the importance of DBT and the therapeutic relationship. Techniques and interventions are really important. Researching constantly just demonstrates that the therapeutic alliance is one of the is strong, and then also that we are giving the best therapy to our clients. Yes, this is where I saw my patients in person and via telehealth. Throughout this case, my role extended to teaching simple DBT skills and incorporating DBT into the therapy session. As a social work intern, I was responsible for building rapport, conducting assessments, collaborating on treatment planning, reinforcing and building new coping skills, documenting progress, and evaluating effectiveness. I also viewed my interactions through the lens of social work values. This meant respecting the client's dignity and worth, promoting self determination, recognizing strengths, and maintaining cultural humility through the therapeutic process. Rather than positioning myself as the expert who had all the answers, I approached the therapy as a collaborative process. Um, we've learned that the client is the expert on their own experiences. And while my role is to provide education, guidance, and evidence based interventions that could help her reach her goals, she really was the driver. Um, this collaborative approach increased the client's investment in treatment because she actively participated in developing the goals, selecting coping strategies, doing the homework in the worksheets that I provided about DBT, and evaluating the process throughout the therapy sessions. So our treatment goals really go hand in hand with DBT's modules. Um, they we focused on improving emotional regulation by increasing awareness of her emotional triggers, helping her learn healthier responses, and knowing when to take a break when situations got escalated. Our second goal was involved in the distress tolerance module, so the client could manage difficult situations without relying on ineffective coping behaviors. Role playing to discuss how she would feel in certain situations, and what she could do when certain things are being said. The third goal was strengthening interpersonal effectiveness through improved communication and healthy boundary setting with loved ones, and then even in in stores. She could have trouble saying no, and so we're setting all those healthy boundaries. Finally, mindfulness skills were incorporated throughout treatment to improve self awareness, reduce emotional reactivity. She had a pretty good set of mindfulness skills and a regimen that she did. So we really just built off of that strength that she had. And I gave her some DBT mindfulness skills that that you will see in the next slide, to help just increase the mindfulness and continue to have those tools in her toolbox. Like I said, each goal was developed collaboratively with the client, to encourage engagement, and to really increase the motivation. And we discussed and tweaked goals as needed. Also, sometimes DBT stuff was she didn't want to do or she didn't feel comfortable, and so we're able to branch off in a different direction or and move on to something else. And so, really working collaborative with her was a big aspect of creating treatment goals. All right, so now I'd like to discuss the specific interventions that can be implemented throughout treatment using DBT. Some are I have used with my clients, others I have not. The following slide will get more into detail of interventions that I have used. So although DBT includes many different techniques, it is much more than simply just teaching coping skills. Each intervention is selected intentionally based on the client's needs, the treatment goals, and the current functioning. Every skill has a purpose, and so your role as a therapist in using DBT is to not only understand how to use the skill, but also when it would be most effective for the client. One of the first interventions to focus on when using DBT is increasing the client's awareness of emotions. Many clients know they are upset, but they struggle to identify what they're actually feeling or why. During sessions, you can explore emotional triggers, physical sensations, thoughts, and behavioral responses by slowing down the situations, examining each step. The client should be able to better recognize emotions before they escalate. One of the or another we also discuss the function of emotions. Instead of viewing emotions as good or bad, we explore how emotions provide information. For example, um, anxiety may signal uncertainty or perceived danger, while anger may indicate that a personal boundary has been crossed. Helping the client understand the purpose of these emotions reduces self judgment and increases self awareness. Another important intervention involves helping the client identify patterns that maintain the emotional distress. Together, you can examine situations that repeatedly trigger overwhelming emotions to discuss alternative responses that align closely with the client's long term goals. Throughout treatment, psychoeducation remained an essential intervention with DBT. Understanding why DBT works increases the client's willingness to practice the skill outside of therapy rather than memorizing techniques. So they can understand the rationale behind each intervention, which improves consistency and confidence with the client. Um, so you can see a few here of specific DBT skills. One of the skills on here is the stop skill. So stop stands for stop, take a step back, observe, and proceed mindfully. This skill teaches clients to interrupt automatic reactions before responding impulsively. So we did use this skill during a session. We practiced applying stop situations when the client, for recent experiences that the client shared, instead of reacting during the conflict, she learned to pause, notice her emotional response, evaluate the situation, intentionally choose how she wanted to respond. Another very beginning skill that is in DBT is that I've introduced was the TIP skills, TIPP, which are designated to reduce intense emotional arousals quickly. These strategies focus on changing the body's physiological response through techniques such as temperature change, paced breathing, and muscle relaxation. These you can really give to any of your clients. They're helpful in moments when anxiety becomes like physically overwhelming. Another important intervention was radical acceptance. Initially, the client struggle with this concept because it's kind of interpreted as like acceptance, as like just giving up. But through discussion and giving examples, you can frame radical acceptance during the DBT training as acknowledging reality rather than approving of it. This shift can allow spending less energy fighting situations than energy focusing on. You can shift your energy to focusing on healthy coping instead of fighting the situations. So one of my favorite aspects of DBT is that these skills are highly practical. Um, Clients often leave the sessions with tools they can begin to use that same day, which increases confidence and reinforces progress between appointments. These are also really skills that I feel like we we already do in that we are taught in therapy. So I think that DBT really just hones in on them and explains, and we can explain why this is important and how. Um, yeah, and they really like acronyms, as you can see. All right, so putting it all together, I kind of want to briefly describe one representative therapy session that demonstrated how all the DBT interventions that I've learned and how it was integrated, kind of expressing my title is putting theory into transformation. So during one session, the client discussed an argument with a close family member, and she explained that the conversation escalated quickly because she felt misunderstood and immediately became defensive. As she described the situation, it became clear that emotions had taken over before she had the opportunity to think through of how she wanted to respond. Rather than immediately focusing on solutions, we first slowed the situation down. We reconstructed the sequence of events by identifying what happened first, what thoughts occurred, what emotions emerged, and how these emotions influence her behavior and the behavior of the family member. And then we were once the emotional chain was identified, we introduced the concept of wise mind, which is another one of the core principles of DBT. We discussed the difference between the emotional mind, where feelings completely drive the behavior, the reasonable mind, where logic dominates. Wise mind represents the balance between those two states. The client reflected that during the argument, she had responded entirely from the emotional mind, which most of us do during an argument. So together, we explored how she might have responded differently had she had paused, accessed the wise mind before speaking. And we then practiced the dear man communication strategy through role play. The client rehearsed how she could express her concerns respectfully while remaining assertive and maintaining self-respect. Before ending the session, we collaborated on some homework. She agreed to practice the dear man strategy during future conversations. And then she said that she was going to journal about situations where she noticed herself moving from an emotional mind to the wise mind. And so that was like one session that I was able to put it all together and with my client and be able to explain how DB and use DBT techniques to really help um, the client in the clinical setting. So, as therapy is still ongoing with this client, we still have seen some measurable improvements across several areas with her as treatment has progressed. One of the first positive changes involved emotional awareness. Instead of realizing she was overwhelmed after an argument had already escalated, she began recognizing emotional triggers much earlier. Um, this allowed her to implement coping strategies before emotions became manageable. She also reported increased confidence using DBT skills independently rather than relying solely on therapy sessions. She's incorporated mindfulness, the wise mind, stop, and interpersonal effectiveness skills into her situations every day. She has reported that communication has also improved significantly with her significant other, and the client says she is more comfortable expressing her needs directly while maintaining those healthy boundaries. Um, so while treatment is still ongoing, the overall trajectory has reflected meaningful progress. So rather than seeking perfection, the goal is to become consistent improvement and increased confidence, managing life's inevitable stressors. One lesson that I've learned through this experience is that success in therapy is often measured by increased flexibility rather than complete symptom elimination. Helping clients respond differently to difficult situations can help provide meaningful improvements in their quality of life and overall functioning and in their relationships. So I do think she's made great progress since seeing her the last few months, and excited to see how she continues on using her skills and making a better quality of life for her. So throughout this case, in understanding DBT, multiple CSWE competencies were demonstrated in everyday um, practice at my field placement. Competency one, demonstrating ethical and professional behavior, was reflected through maintaining confidentiality, documenting service accurately, seeking supervision regularly, and practicing within the boundaries of my role as a student intern. Competency two, advancing human rights and promoting social, racial, economic, and environmental justice, was demonstrated by respecting the client's dignity, recognizing the influence of environmental factors on mental health, supporting her right to make decisions regarding her own treatment. Competency four, engaging in practice-informed research and research-informed practice, was demonstrated through the intentional use of evidence-based DBT intervention supported by current research. Treatment decisions are based on empirical evidence rather than personal opinion. Competency six, engagement, was reflected through establishing a strong therapeutic alliance built on trust, empathy, and collaboration. Competency seven, assessment, involved conducting ongoing biopsychosocial assessments, identifying client strengths, evaluating environmental influences, and continuing reassessing treatment needs. Competency eight, intervention, was demonstrated through psychoeducation, skill training, collaborative goal setting, implementation of DBT interventions throughout treatment. And then finally, competency nine, evaluation, occurred continuously. We regularly viewed homework, discussed progress towards goals, evaluated treatment effectiveness, and modified interventions based on the client's response. Looking back, I now realize that the competencies are not isolated tasks. Instead, they are integrated into like every stage of the helping process and the treatment process. First session, even from intake through um, if you are terminating the services. And then the competency examples, these competencies were not isolated events, but were integrated throughout all the stages, like I have said: building the rapport, supported engagement, assessments, informed treatment planning, evidence-based interventions, guided our clinical decision making, ongoing evaluations, ensure that interventions continued meeting the client's needs. And then the importance of clinical supervision also played an important role by providing opportunities for reflection, feedback, and continued professional growth. So as I conclude this presentation, I want to emphasize that this experience reinforced the importance of integrating evidence-based practice with the core values of social work. While DBT provided the structure and skills that guided treatment, it was the therapeutic relationship, collaboration, and respect for the client's strengths that really made these interventions meaningful. Um, I understand that learning a new therapeutic technique like DBT takes a lot of practice, and I still have far to go. And I think it's really awesome. I feel like I started this field placement with learning so much about DBT and the DSM, and so being able to move from understanding and seeing a theory to putting it into practice has been amazing. Professionally, this field placement has challenged me to like move beyond applying the theory and clinical skills to these real world situations. I gained confidence in conducting assessments, developing treatment plans, implementing the DBT interventions. Um, most importantly, I developed a deeper appreciation for the responsibility and privilege of walking alongside clients during these difficult times in their life. I also want to take a moment to thank my field placement supervisor, Alex. Her patience, encouragement, mentorship throughout this journey, her passion for social work, her exceptional clinical skills, and unwavering dedication helped me. I'm incredibly grateful for her knowledge and opportunities she's given me. Um, as I continue in my clinical social work, I hope to carry forward the lessons I've learned during this placement and about DBT and remain committed to ethical practices, lifelong learning, and evidence-based interventions. And if you have any questions, gladly will take them. And thank you for your time and attention. And I appreciate the opportunity in sharing my experience. Thank you all.